Okay, this is a case where the student had a patient asking for a reline. Okay, so before the reline, I was asking many questions about doing the mapping procedure. The mapping procedure is explained in another video. It's called mapping, looking for overextensions and patient complaints using the mapping technique. This is not present in textbooks. It's a technique that I've developed where I found it very useful for the patients. You can find it in another video. While we were mapping, we found that there was pain in the genial tubercle area, and there was pain in the buccal pouch, this area, okay? Buccal sulcus, sorry, on this area. This is now the buccal flange on the denture, but inside the patient mouth, it was in the sulcus, and we felt the patient was responding to pain and reporting that there was pain. So I asked the student, first of all, before doing relining, to do this step, where we have placed light body rubber material all over the fitting surface. And he has done that with all of the movements of border molding. So what did we find? What did we find? This is an old denture for the patient. He was using it for a long time, and we have found that there has been some resorption in the bone, but the resorption was not accommodated by the denture seating better. Okay, why? Because there was the bone here in the genial tubercle, or the origin of the lingual frenum was prominent, so the denture could not go in more. Okay, so it did not follow the resorption. The denture was stopped by this bone, so that it was traumatized, and this is why the complaint from this side in the lingual frenum area. Okay, the another complaint also with the resorption of the bone, these became overextended. Now this is the area that he complained from, but the problem with old patients, and I always emphasize this, the way they report pain is they underestimate their pain. They're always in discomfort and they cannot locate the pain. Why? Because there is a neurological weakness, and there is locomotor weakness. So even the patient is in pain from this side, but he did not report it. We